Hi, I'm Jeff Ullman from Boulder, Colorado, and also Los Angeles. I'm in the medical cannabis business, but I'm also the husband of a stage 4 breast cancer metastasized liver patient. I trust Mara with my wife's life. Thank you. And so far, her cancer markers are down about 26%. Not enough for a trend yet, but soon. Thank you. My question has to do with dealing with oncologists. Even in Colorado, they don't know anything. And they don't know much about nutrition either. What can you tell us, both, I consider myself a caregiver, about how best to work with an oncologist who doesn't know that she's a hammer and the world is our nails. You know, they don't allow for cannabis or nutraceuticals or nutrition to enter into their consideration of treatment.
Okay. This is a question. I'm going to answer part of it, and I'm going to ask Dr. Joe to answer part of it, okay? Because we were doing this quite a few years before Dr. Joe joined us, and this was something that came up, especially, back in 2011, your oncologist who told them you were using cannabis, they were, going to take you to a psych ward. So what we do is we make it very, very clear that the patient, when they're having the conversation with their oncologist, is that we are there to help them be more successful in treating their patient. It is still their patient. We are not in competition with their oncologist. We are there to supplement and help the work that he or she is already doing. So, for example, one of the little tricks I'll just give you. While somebody's going through, let's say they're on a regimen that's a 3-to-1 ratio or 4-to-1 ratio of THC to CBD, they're on a very high. And one thing I didn't mention earlier, and I think it's important to mention here, is there seems to be an inverse relationship between the age of the patient and the dose. The younger the patient, the higher the dose of cannabinoids. So you'll see children on, a total of cannabinoids of 800 milligrams sometimes a day, and adults, maybe somebody on 150 total or 75 total to achieve the same thing. It's really remarkable. But anyway, back to this. When a person's going through active chemotherapy, we'll usually at that point reduce down the CBD to quite limited and let the THC get in there and help to protect the healthy cells while the chemotherapies are doing their drugs. And we make it very clear to the oncologist that we want to help him or her be successful, that that's our goal. Our goal isn't to say, well, we know a better way or another way, or you're the enemy and you're the bad guy, that we're all in this together. And then inversely, after the chemo rounds, oftentimes, depending on the time frame, 2-3 weeks later, is where you have these opportunistic infections that occur, where you have, C. diff. Sometimes people are hospitalized for long periods of time while they're going through the chemotherapies. And during that time, we'll then reduce the THC quite low and increase the CBD to help protect them from these infections. And we just let the doctor know that they're the boss, but we also let the patient know that they're the employer. They're the one that hired this boss. They're the one that hired this oncologist. So don't forget, the doctor's in charge of your health, but you're in charge of the doctor. So Dr. Joe can talk to you from a very different perspective.
When I interview a new patient, one of the questions I ask is, does your oncologist know that you're going to be using cannabis? If the answer is no, I strongly recommend and suggest that they let their oncologist know that they're doing this, because I say we're a team. We're all working together in your behalf, and if one person doesn't know what the other is doing, it can create problems. I recently had a breast cancer patient that was taking tamoxifen, and tamoxifen is a pro-drug. It means tamoxifen doesn't have any activity on its own. It has to be metabolized in the liver, and the metabolite is what is the actual drug. And so since this patient was going to be on high doses of CBD, and I knew that CBD blocks the metabolism of tamoxifen in the liver, I knew that the combination of the traditional therapy and the cannabis therapy was going to create problems, and she wasn't going to get the benefits of the tamoxifen. So I wrote a letter to the oncologist, explaining that interaction and saying that it would be, I know that there are other drugs that do the same thing as tamoxifen, and it would just be a simple matter of the oncologist making the change. So I wrote a letter and I sent it to the patient. I put it to who it may concern, and sent it as an attachment. The patient forwarded it to the oncologist, and within 24 hours she was on a different drug. So you have to work as a team in order to have maximum success, and if you don't work as a team, you have the potential to create problems.
Dr. Joe, I want to say thank you as well. You're a fantastic physician for my wife. Thank you.